Hello and welcome. I'm Dan Moulthrop with the City Club, here today with Barbara Snyder, President of Case Western Reserve University, and Tom Mihaljevic, CEO of the Cleveland Clinic. And we're going to talk about the new health education campus. Barbara, just tell us about this new state-of-the-art facility. This is kind of really exciting.
Well, it is an incredible building, 485,000 square feet, designed by Foster and Partners out of London. And we are excited about the design because this was created to house our programs in nursing and dental medicine and medicine, Cleveland Clinic Learner College of Medicine, our physician assistant program, all under one rather large, beautiful roof.
This is astonishing to bring all of these programs together. It must be really meaningful for the learning community.
We think it is because we talk a lot about, and you'll probably hear Tom talk a lot about the importance of team-based care, because in the hospitals, that's the way care needs to be delivered today. But in the educational environment, we haven't been educating students with that in mind. We have had them, all these programs, in separate buildings, which probably some would say creates a siloed atmosphere, and we are excited to put them all under one roof where they will learn together, but they will also have lots of informal interactions together too. There's one place to eat in the beautiful atrium, and there's going to be a technology bar in there, so they will go to get their technology needs met. And we think that that informal interaction, as well as the learning that will take place in formal settings like classrooms, will promote more of a team-based thinking about healthcare from the minute they set foot on our campus.
Tom, the clinic's history is one of kind of constant innovation. Can you talk a little bit about how this fits in with that history and kind of moves us forward?
Yeah, we are critically dependent on innovation and education. You know, the way we look at healthcare is the care that we provide today, traditional healthcare, is provided by people who are in our, who work at a Cleveland Clinic. But a healthcare of the future is pretty much determined through research and innovation and education. So this educational effort fits very, very well into Cleveland Clinic's strategy to continue to be one of the leading healthcare centers in the world.
Barbara mentioned the team-based approach and how important that is, and I know it's important to you in your leadership philosophy. Can you talk a little bit about your leadership philosophy as well as how you see that being kind of integrated through the new campus?
You know, the team-based approach, the Cleveland Clinic has been there from the very beginning. Our founding fathers, almost 100 years ago, in 1921, had a slogan to act as a unit. To act as a team, because they recognize that healthcare is an ultimate team sport. In order for us to meet the demands of our patients and their families, the best way to do it is by working as a team.
This isn't the first time your organizations your institutions have been partnering. Can you, Barbara, talk about the impact over time of the partnership and what students have been learning?
Our students and our faculty and our staffs have already gotten together and have many programs already going on. So we are excited about this building because it will provide a beautiful space for those things to happen and remove some of the barriers that have been there before, the distance and different places on campus to get together. But our students have been working together all along, and medical students from Cleveland Clinic Learner College, working with social work students from the Jack Joseph and Morton Mandel School of Applied Social Sciences, have been exchanging information and have learned things from each other about how they both bring things to the table that can help provide healthier outcomes for patients.
It's really interesting the way these partnerships, Tom, are really continue, as Barbara describes them, continue to be focused on the patient. The patient first, the patient at the center of everything. Can you talk about how you teach that and how you practice that?
Well, patients first is our motto. Everything that we do, we try to look at through patient's eyes. The way that we organize, the way we provide care, our reason for existence are our patients. So I think this is deeply, deeply ingrained in the fabric of both of our organizations, and I think it is relatively easy to teach it because I believe that every member of our organizations really lives that ideal every single day. And so that is of a paramount importance and that's probably one of the biggest differentiators that we have as a healthcare providers.
Barbara, this is a new, as you recognized earlier, you mentioned earlier, this is going to break down some of the silos that may have inadvertently been created in the past structures. How important do you see that as being for incoming students?
Well, we think it is important to communicate the ultimate message, which is the goal is the best possible patient care. Mm-hmm. And we know from research that team-based care provides better patient outcomes and also provides more satisfaction for the healthcare providers. So we think they will appreciate their professional choices even more because they've learned to work in teams, and we are prepared to help them become better at that, starting from the moment they are first-year students in whichever program they enter at Case Western Reserve University.
Tom, that's pretty different than how the med school you went to, I imagine.
Yeah, that is true. Yeah, well, all of us who are currently in practice and who were in practice were educated in the traditional environments where physicians were educated separately from the nurses or other healthcare professionals. And then for the first time that we met and started working as a team, it was the first time we got our jobs, which is certainly not optimal. And we hope to change it through this interdisciplinary learning, which will be promoted at a health education campus.
So that means, so you've had to spend part of your career unlearning what you learned in med school in that way.
Oh, certainly, yes, certainly. And then also, learn how to effectively interact, communicate with other members of healthcare professions. And ultimately, that is really what our patients expect from us. That's what their families expect from us, is they really embrace to be cared for not just by an individual, but a group of individuals.
Barbara, what are you hearing from incoming students and prospective students about this campus and these innovations?
They are genuinely excited to be part of this new place and looking forward to not just the beautiful physical space, but it is beautiful, but also the opportunity to interact with students from the other professions, starting from the very beginning. I think students recognize that team-based care is the wave of the future and is better for patients. And they all chose their professions because they want to serve patients and they want to do the best they can for them. And I think they believe, as we do, that this is going to help them do that. And so they're excited, we're excited, and looking forward to opening the building formally next month, but students will start shortly after that.
That's exciting. And Tom, with the Lerner College of Medicine, the clinic has done some really important things in recent years to move that college to basically one of the most competitive programs in the country, if not the world. This new innovation, giving medical students the opportunity to learn alongside nursing students and dentistry students and others, must be really exciting for the incoming students. Yeah,
it is very exciting, and our partnership with Case Western Reserve University has been immensely exciting and stimulating for our organizations, and I think ultimately it shows also how team effort, by bringing, so to say, teams from different organizations, really can create a transformational effect in a way that we educate future caregivers. And we certainly, I know that Barbara and I share the vision that Health Education Campus will bring so to say, the center of medical education closer to Cleveland, Ohio, because of the uniqueness of this effort.
It's it's an extraordinary partnership, and Case Western Reserve University partners with so many institutions and organizations, as does the Cleveland Clinic, but to have these two really extraordinarily large anchor institutions partnering is, it's the ultimate team of teams, isn't it?
Yeah.
We think so too, and one of the reasons we're excited, you mentioned students, but our professionals, our faculty, our staffs, they have gotten together too, and they are genuinely excited about what's going to take place in the new building. So we are looking to the future with tremendous excitement and anticipation.
There's a lot of gee whiz tech going into this facility, the HoloLens, the Zygote, all of that. Tom, can you talk a little bit about it?
Yeah, well, the technology is transforming the way that healthcare is being delivered, but not only the way that healthcare is being delivered, it is also transforming the way that we learn about healthcare. you know, the explosion of knowledge in healthcare is difficult to comprehend by a single person using the traditional means. But we're also leveraging technology to teach our students more effectively. That technology includes, as you said, HoloLens that allows the 3D images of, let's say, human anatomy for better understanding of how human body works, functions, and how it's essentially organized. But that's just one example of very many different technologies that are going to be available to our students. And when I walk through Health Education Campus, when you take a look at the interactive classrooms, the big screens, the digital bar that helps you solve all your tech problems, you know, I wish I could go back to med school again, because it looks nothing like the med school that I attended.
I'm sure. I'm sure. I mean, there's got to be the classes that you never even envisioned in terms of, you know, information management, decision. I mean, like the decision making and the diagnosis procedures have to be completely different than they were.
Oh, absolutely.
Even 5-10 years ago.
I mean, today we live in an exciting world when a lot of professions in healthcare that are currently already well established as a healthcare information technology. They did not exist when I used to go to med school. The terminology did not exist. Yeah?
Right.
Interdisciplinary learning as a phrase, as a terminology, is new. And we have been now able to accelerate the new concept into the reality for the future generations of our students here in Cleveland, Ohio, and that is immensely, immensely exciting.
Coming back to technology for a moment, in addition to the HoloLens and Zygote, there's a number of simulators and things that didn't exist when you were going to school, I'm sure, are brand new to the world of health education. Can you describe some of that for us, Barbara?
The world of simulation has changed dramatically and improved for students. So as a teaching tool, simulators are far more sophisticated today. So you can do a simulated ultrasound on a mannequin. That doesn't do it justice. It's really a computer that looks very much like a person, and you can have the experience of doing an ultrasound and making a diagnostic judgment with it being completely simulated. And it's pretty remarkable to be able to do that.
And the simulator can present all sorts of different kinds of symptoms.
All kinds of things. And then, of course, we have our flight nursing program and the opportunity to create very real-life simulations with these mannequins. You know, landing in the helicopter from a remote site, taking the patient who's the mannequin/computer, but the experience of doing all that, rushing them off and into the hospital and providing care all along the way, which is exactly what happens in a real-life situation. So the ability of these computer-driven simulators that look like human beings is amazing.
This is very different than trauma care training was 10 or 20 years ago, Tom.
Of course, because traditional medical training was deeply reliant on the experience in the direct patient care. So most of us have gone through traditional training in which our first procedures were supervised by a senior physician, but were essentially performed with the patient at the patient's bedside. And we do believe that this technology...
I've never done this before, but I'm not going to tell you.
Yeah. Well, not quite that way, but it was certainly something that was difficult to predict, something that was difficult to repeat, something that certainly did not offer the appropriate environment for learning. And the simulators, simulation centers, for example, and the technology associated with it allows us now to learn in a space at a time that we can dictate, do it in a way that is much more predictable, that truly allows people to master techniques and procedures in ways that are going to then translate immediately into better patient care.
You know, I want to come back to something that you both mentioned earlier, this sort of breaking down of silos and a new model for healthcare education. That has the potential to transform the future of healthcare. And I don't know of any other med schools that are breaking down silos in this way or in such a dramatic way. What do you think the impact is going to be 10, 20 years down the road?
We'll be studying that, absolutely, but we know from research already that team-based care done most effectively does produce better patient outcomes. And so we think that we are going to be training students to become professionals who will be able to deliver care more effectively in teams, and that means with better care for patients. That's the ultimate goal. That's the reason they all have chosen to be part of the healthcare profession.
Tom, what are you hearing from med school leaders around the country about what you're doing?
Well, they're all very excited. They're all very excited because they see that we're doing something that I believe very many of them would warmly embrace in their own environments. And this is this pioneering role that we here in Cleveland have, and we can have it because we have such a great collaboration, and we have the organizations that breathe with a similar culture and ethos, and quite frankly, an aspiration to make a difference.
Let's talk about community impact for a moment. Both of your organizations are, not only serve the students and others, but really are community-facing organizations in many, many ways. And a lot of the ways in which you serve the communities that surround both institutions have to do with the delivery of healthcare. This is going to be a new opportunity for students to engage in that work and for the community to benefit from that work. And Barbara, I wonder if you could just talk about that a little bit.
We already have a student-run clinic that all of our students participate in from the various professions, and we are looking for additional opportunities for students to serve the community in that way, and already coming up with some truly great ideas. And of course, the dental clinic, which is across the street from the main Sheila and Eric Sampson Pavilion, will be open to the community as it is now, although in a much larger and nicer space. So we will be able to serve even more patients from the community. They pay a lot less than they pay in a dentist's office. We take patients who rely on Medicaid for their treatment as well. And we are excited to be able to serve even more people with much easier parking and a more beautiful space to welcome patients.
That's wonderful. Tom, do you see this as changing, as potentially having a broader impact or a deeper impact on the Huff and Fairfax neighborhoods that surround the clinic?
Well, we certainly believe so. We are firmly anchored in our neighborhood. As I always like to say, we're here and we're here to stay. We will always be here.
The community, when you think about the communities that your organizations serve, isn't just the neighborhood, but it's the patients as well. And you mentioned Sheila and Eric Sampson, and I wanted to ask you, Barbara, if you could share a little more of their story.
So they were actually patients of, Eric was a patient of Dr. Cosgrove, and that's how they came into contact. And when I first met them, we were in the early days of talking about this project. And Toby brought me to meet them, and we had an opportunity to explain what our idea was behind the project. And it wasn't built yet, wasn't fully designed yet. We were just in those very early stages. And they were excited too about the possibility of doing this. And when we had a celebration, when we named the building officially the Sheila and Eric Sampson Pavilion, we got to hear some beautiful words from Eric, who talked about what this meant to him and to his family, that this building, this beautiful building, would bear their name and would be a legacy of gratitude I think they have for the care they got at Cleveland Clinic, but also a legacy about the future of training future healthcare professionals. So it was really a privilege to be able to work with both of them and with their families, and we're excited to be able to show them what we're going to do with it, right?
Yep, absolutely.
And Tom, Sheila and Eric Sampson are not from Cleveland. The clinic is their connection to Cleveland.
Correct.
Tell us more about that.
Well, we have a good fortune to be able to provide Cleveland Clinic care for many people throughout the world. And this is one of our proudest accomplishments, when we can improve the lives of any person. In this particular case, Eric and Sheila are from South Africa. So they're South African, and through the compassionate care that they have received here at Cleveland Clinic, Cleveland has become, so to say, their second home here in the United States. And they have seen not only the quality of care that is being provided here, that they experienced also, but the enthusiasm for research and education, and understanding that in order for us to continue to do what we've been doing so far, we have to continue to innovate, and we also have to continue to educate those who will carry Cleveland Clinic legacy in the future. and they have come across with a very generous gift. And philanthropy really allows us to do projects, transformational projects like Health Education Campus.
I want to ask you one last thing about the architecture and the importance of space and design to a project like this. It's not just a building, it's a really extraordinarily beautiful building, as you've mentioned a few times. And can you both just reflect on that and the importance of space and the design of space, not only in providing an educational opportunity to these students, but also for the patients that they serve?
From the very beginning, we thought about what it would take to create the kind of educational place that we were seeking, not just a physical space, but that's critically important, but also a space that would foster the kinds of interactions that we were hoping would take place in the Health Education Campus. And it was from the very beginning designed with that in mind. So there are a lot of spaces that were created with the thought of interaction. There's a large atrium. There are stairs in the corners of the building where people will definitely run into each other, where spontaneous combustion, as we like to call it, can take place. And there are lounges throughout the building. There aren't separate lounges for medical students or dental students. There are student lounges and shared spaces all over. And there will be some formal interactions in some of those interprofessional courses that our faculty will teach.
Tom's very different than the legacy buildings that you have and
that anyone has. Yes.
that exist at a lot of hospitals around the country and med schools as well. I mean, this is a giant step up.
It is a giant step up, and we do not look at the architecture purely from the aesthetical standpoint. Is that right? I think it is a really beautiful mixture of wonderful aesthetics and a function and a functionality that we desire. Where the architecture really fosters the right behavior. Mm-hmm. It doesn't provide just an environment. It really fosters the right behavior, the right flow through the building. And Foster & Partners are really known for doing so. They have assisted us historically in the design of quite a few buildings at Cleveland Clinic, and that partnership has been ongoing and very fruitful.
What's the aspect of this that you both are most excited about and most looking forward to, Barbara?
I think seeing the students and the faculty working together in that building is going to be the most exciting thing. So I can't wait for the first classes to start. I'll be over there.
Tom?
Yeah, we're all going to be over there, absolutely. The most wonderful legacy that I think any of us can leave behind a generation of people that we help educate. Because I think the ultimate testament of leadership presents itself after the leaders are not there any longer. And I think our leadership lives through people that we teach and educate. So I cannot think of a greater purpose, quite frankly, in anybody's job.
So talk to us in 20 years after we're bringing all these initial classes back for a reunion, and we'll know more because we'll have done some research on them. But we will also understand from their direct experiences how they felt about their education and whether we've lived up to the promise of the legacy that we're trying to create here.
Well, by all measures, it appears that both of you are changing the world, and I thank you.
Thank you.
Thank you.